Hey everybody, thanks for joining me again. If this is your first time, my name is Marie. I'm at a place to heal, and you've come to the right place if you want some healing. Today, I'm going to be talking about diabetes, and because diabetes is something that is very close to my heart. 3 years ago, I walked into a hospital with a glucose number of 724. And now when I look back and I hear numbers like that, I realize that these numbers can actually kill you. For those of you out there who are unaware, diabetes is just basically just overtaking the planet. It's almost like a plague right now. And I had a grandmother who actually died of a diabetic coma. So, like I said, diabetes is very close to my heart. And if you think that that is something like unheard of, you're sadly mistaken. Diabetic comas are very common. If your numbers get too high, it's very easy to go into a diabetic coma. And if your numbers get too low, it's very easy to go into a diabetic coma. So it's very, very, very important that you keep tabs of these numbers and find out what is going on inside your body. The first thing that I want to do is I want to share some stats with you, and this is actually coming from the diabetic database. It's at www.diabetes.org, so it's the official site for diabetes, and I am going to read you some of these numbers because I think that they're very profound and eye-opening. There are 18 million people diagnosed with diabetes. There are 7 million people that are undiagnosed. And there are 79 million people that are pre-diabetic. Men have a higher rate, not much. Men are 13, women are 12%. Have a little bit higher rate than diabetes, with diabetes than women do, which is kind of rare because I run into more women diabetics than I do men. And there's also certain races that are more prone, of course, like everything else, high blood pressure, you name it. Hispanics are 11%, and non-Hispanic blacks are 12%. So the non-Hispanic blacks are at the top of the list, but just because you are non-Hispanic and you're white does not mean anything, because most of the people that I've recently worked with that are that have diabetes are white. They're of no race. So diabetes is not choosy. And among Hispanics, the Puerto Ricans have the highest rate at 13%, and Mexican Americans at 13%, and Cubans come in at 7%. So I have my notes because, like I said, when something is very dear to my heart, I definitely want to make sure that I have my notes because I want to make sure that I touch on what I need to touch on with you. So I guess my question to you guys today is, what is your number? Everyone should know their number. Everyone. My wish would be to be able to walk down the street at any given time, go up to anyone and go, what is your diabetic sugar glucose number? What is it? And they should be able to tell me without even batting an eye. Everyone, whether you are diabetic, if you have someone that was diabetic in your family, if you've never even thought about being diabetic, if you're pre-diabetic, you need to know these numbers. It is ever so important. It's a very simple test. It's easy to take. It literally takes seconds. The supplies are very inexpensive. And I'm going to show you today the supplies that you will need, how to do them. You will have no excuse after this video. And everyone needs to know this because it's very, very important for your health. It's something that you don't even have to go to your doctor to do. And doctors are not giving these tests to people, and they oh my gosh, they should. And you need to demand this test if you go see a doctor. You need to, I would like to be tested for my blood sugar. Everyone needs to know, because by the time that you're pre-diabetic and by the time you're full-blown diabetic, it's just gone too far. You do not want to wait until you are having to take insulin or, you know, having to really get on it to reverse things. And diabetic is reversible, and it can be completely turned around. Because when you go see doctors, doctors will tell you diabetic is a blood sugar issue, diabetic is a glucose issue, type 2 diabetes, please, I cannot repeat this enough. Type 2 diabetes is not a glucose issue, is not a sugar issue, it is a food issue. What you pick up with your hand and put into your mouth is going to decide whether your numbers are going to be very high, whether your numbers are going to be very low, and how your body is going to react. So you need to find out how to eat properly. You cannot get rid of diabetes if you continue to eat the same way and drink alcohol and everything that you're doing. You cannot reverse type 2 diabetes. I also want to make something else very clear in this video. I have some people that I have come into contact with who have asked for my help, and I haven't continued helping them because they tell me, you know what, I'm taking insulin, so I don't really have to watch my diet because my insulin is controlling my diabetes. You know what, I'm on metformin, so it's controlling my diabetes. That's exactly what it's doing. It's just treating it. But underneath it, that disease is continuing forward and is still doing damage. Unless you stop what you're doing, you reverse the process, get off the medication, and reverse everything, that disease is continuing forward. It's progressing forward. It is not stopping. You need to stop it in order for the damage to stop. So please always remember that, because the doctors will tell you this will treat it. Yes, it will, but the disease is still continuing underneath. It is not curing it. And what you want is you want to cure it. You do not want to treat anything. You want to cure it. Okay, so I heard a statistic the other day where they said, and I highly believe it, that by the year 2020, the United States will be completely diabetic. Everyone, one out of every person that you come in contact with, there's only going to be like one person that you come in contact with that's not going to be diabetic. Everybody else will be. And I can very easily see that happening because of our choices in food, drink, and in our behavior. I can very, very, very easily see that happening. Soda is a huge, huge issue with diabetics. Food, what we put into our mouth, is a huge, huge issue with diabetics. And also your thought pattern has a lot to do with problems with diabetes. So I can very easily see that. Unless you're on a very good diet and unless you know what is good for you and what isn't, chances are, yeah, it's very easy for you to become diabetic or pre-diabetic. Another problem that I found, that diabetes is not only a food issue, but it's also a liver issue. And it's very high up there. Don't think that there's just a few people with liver problems. It's actually a very huge problem, because once you start eating all these foods that are very acidic and very putrefying to the system, it starts to make your bile very sludgy. It starts making it very slow. And once your bile slows down and it becomes very slow, it stops your pancreas from doing what it's supposed to be doing. So whenever someone comes to me and they say, I have diabetes, I tell them, okay, change your diet, clean your liver. Change your diet, clean your liver. That is the rule right there. You need to change your diet, clean your liver. You do those two things, and I guarantee you that you can reverse diabetes. It's been proven over and over and over again. There's a great book by Dr. Gabriel Cousens. I believe it's called "You Can Reverse Diabetes" or "Diabetes is Reversible," and awesome book. Great book. As soon as I absolutely, positively, am positive the name of that, I will put the link down below for you guys so you can click on that and get it. All right, so let's move on. Everyone needs to have a meter to test your blood sugar. They're little, they're compact. They come with a little pouch. You can throw them in your wallet. You can carry them with you. You can throw them in your truck, whatever. But everyone should have one of these. If you do not have diabetes in your family, you've never thought about diabetes, you know, the whole works, you should at least be testing once a month. If you are pre-diabetic, you should be testing at least once a week. And if you're diabetic, you should be testing every day until you get these numbers under control. So this is your little meter. Now, what I found with these meters is that a lot of people will sit there and say, well, I can get this meter for like $5. Hey, I can get this meter for free. Okay, the trick is not the meter. The trick to that is the strips. You don't want a cheap meter. You want cheap strips, because this is where the money comes in. These things are now on the black market. People who have, you know, who have insurance or, you know, or state insurance or whatever, they will actually buy these. Diabetics will actually get these for free with state insurance or their insurance, and they will actually not test. They will turn around and they will sell these on the black market because they know that they could get money. So now you see people wanting to buy your unused diabetic strips, and which I think is ridiculous. But anyway, this is where they get you. Okay, this so what I did was I did not go for the price of the meter. I went for the price of the strips, and the cheapest strips that I found are the Rely On Ultima from Walmart. These are the cheapest strips. This box contains 20 strips, and it's about $10. So you're looking at about 50 cents a strip. Okay, some of these strips can run up to $2 each. So, and it goes with the Ultima Rely On meter. It's very easy to use. It only has 3 buttons: the on button, the backwards, and the forwards. And the backwards and the forward, it keeps track of your numbers that you took. So you don't have to write them down and keep track of them. You just go backwards and forwards, and it'll tell you the date and what your last number was. So that comes in really handy. So basically what you need to do is you need to buy yourself a meter. This meter will run you, I think it's $18. Okay, so you buy yourself a meter and you get yourself the strips. You're looking at $30. And then you get yourself the lancets. The lancets are the little needles that go in there. You're looking at about $5. And if you absolutely want to, you could get the alcohol swabs. Okay, because they're really convenient. I put them in my little pouch to go, so it's great. And I'm going to teach you today how to check your blood sugar, because it's very important. So, now they tell you on these little lancets, they will tell you, I'll show you here, they come in a box just like this. And these little lancets, they look like that. Okay, and there's, I don't know, there's quite a few in here. There's 200. Okay, so they tell you to change these every single time. I kind of get lazy, I know, I'll admit it. But from my point of view, and what I suggest to you is, you know, if you want to use them more than once, that's fine, but do not use them more than 2 times. And the reason that is because after 2 times, it starts to hurt. If you only use it once, you use it twice, it's okay. But by the time you use it the 3rd time, it starts to hurt, and you don't want any pain. You don't want to feel any of that. So with your little meter, you get this little doohickey, and your lancet actually has a little round cover on it. So what you do is you just twist it off and you have your needle. Okay, and this one you just twist and you pull, and there's your needle. You take out the old needle, you put in the new needle, push it all the way down, and you just pop the cap back on. If I can do that. Okay. Now, I have my alcohol. I usually pop open my alcohol, and I have it ready. Now, do not clean your finger off, because if you clean your finger off, you're going to get an inaccurate reading because of the alcohol. So if you ever go to the hospital, you ever go to the doctor, you ever go to get tested, and they clean your finger off with alcohol, you know that the person knows not what they're doing, because they have no clue. You should never do that. It will give you an inaccurate reading. Next thing you do, you take your little, this is your tester, okay, your test strips. And on the test strips, there's a little V. You just push one way and the other, and it'll give you, it'll pop open if I can. And there you go. Okay, on one side of this test strip is a bunch of lines, almost like a barcode, because it is a barcode. And on the other side, it's a little white spot, and that's where you collect your blood. So what you're going to do is you have your meter, there's a little yellow spot down at the very bottom, that's where it goes, and you're going to take the barcode side, not the blood collection side, and you're going to put it in there. Just going to pop it in. When you do that, a bunch of zeros are going to come up, and then all of a sudden you will see a little test strip sign with asking you for blood. So the next thing you're going to do, you're going to pull this all the way back. That will activate the needle. You're going to take your finger and you're going to push the blood up to the top. If you don't do this, sometimes you don't get blood. So you want to really push that blood up to the top, and you want to go as close to the top as possible, not very close to your fingernail, but pretty close. The further down you go, the more it's going to hurt, so you want to stay up towards the top, and you just pop the little blue button. There you go, and you have blood. Okay, I just drank a smoothie, so I have no. You are supposed to do this on an empty stomach while you're fasting first thing in the morning. You collect your blood, it beeps. And it'll 4, 3, 2, 1. I have 117. That's actually pretty good. And I just had a fruit smoothie, okay? Now, you should be doing this on, and now you can take your alcohol and clean it off. You should be doing this in the morning while you are fasting on an empty stomach. When you take your reading should be between 70 and 85. If you are over 100, if you are close to 100, 101, 115, see, mine doesn't count because I just had a smoothie. I should have done this morning, but I had to run and meet with a client. You should have been taking this in the morning, and mine usually runs around 82. Okay, so you take it while you're fasting on an empty stomach, and you saw how quick that was. 4 seconds, that's all it takes. And you want to dispose of all this stuff properly. And it only takes a few minutes to test. And if you are between 70 and 85, no worries. If you are 100 or slightly above, you're now pre-diabetic. And you need to start doing something to start taking care of yourself and start doing some diet changes and maybe getting some exercise into your routine, you know, cutting out the sodas, whatever the case may be. If you are on a resting, if you are over 120, you're in trouble. You are now diabetic, and you need to start taking care of this issue, because as the numbers rise, so does your chance for a heart attack or a stroke. And that is very serious. Another issue, because as your pancreas stops working, a lot of organs start taking the brunt of the problem. Another issue that you're going to have is your feet. You're going to start losing, feeling in your legs. I had problems with my feet where I could not feel my legs. I used to have really bad tingling in my legs, and at that point it becomes very dangerous, because if you walk barefoot, if you happen to get athlete's foot between your toes, you don't know it because you can't feel it. You don't have feeling. If you step on something and you get an infection, you could lose your whole foot. I cannot even begin to tell you, when I was in the hospital, how many people I passed in the hallway that were missing toes and had had their foot amputated or had had their legs amputated. Please do not wait that long. If you are diabetic and you can't look at the bottom of your feet, have someone else look and see if there's any marks, anything that you need to watch out for. Every night when I take my shoes off, I look at the bottom of my feet. I check both of my feet, and I feel between every single one of my toes to make sure that I have no cuts, no infections, no nothing. It's now, I don't have that problem anymore. I can feel my feet just fine now, but I'm still so adamant about that. It's now become this huge habit with me. Another problem is nail fungus. If you notice nail fungus on your toes, start checking your blood sugar. I mean, it's very huge among diabetics. When I first was diagnosed, not on my left foot, but on my right foot, I had 2 nails that were completely distorted. They were very thick and they were very yellow and nasty. And you know what? Now I don't have that anymore. My nails are now normal because the circulation to my feet have gotten good. And if you have any problems with nail fungus and it's starting, it has a tendency to spread through the toes and up the feet. You don't want that. So even now, even though my nails are back to normal, I soak my feet once a week in apple cider vinegar or even white vinegar. And every night before I go to sleep, I put peroxide. I spray peroxide on my toes because that will keep all the fungus away. Another issue that you're going to have is your eyesight. If you're starting to see floaters, if you're having vision problems, please pick yourself up a meter, check your blood sugar. These are serious issues. One of the biggest causes for blindness in the United States is unchecked diabetes. I do not get glasses every year. But every year, my doctor knows, my eye doctor knows that I only get glasses every 3 years. My eyes don't change that much. But every year, you need to go in and have your eyesight checked, and you need to have the dilation test done. It's very important if you're diabetic. I don't get glasses like I said, about every 3 years, but I am adamant. Spring, as soon as spring hits, I know it is eye testing time. I go in, I have my eyes tested, I have them checked, and I have my dilation test done to make sure that I'm not going to lose my eyes. You only have the one pair, and you cannot replace them. You need to try to save your eyes at all costs. So that's very, very important. Another thing that I found is that when you start having diabetic problems or diabetes problems, you're very, like I said, very, very, very prone to have heart attacks and strokes. One of the biggest giveaways for an upcoming heart attack and an upcoming stroke is check your face. Even if you have to use one of those zoom in mirrors, check your cheeks. Check to see if you have any broken capillaries, okay? Any little veins, broken veins. When I first got diagnosed with diabetes, I had broken veins all the way across my cheekbones. Now, they've gone away so much, I can literally cover them just with my finger. But this is a surefire sign. Your face is giving you signals that a heart attack or a stroke is on the horizon. You ever see those people who drink way too much and their nose swells up and they have all the broken capillaries on their nose? Yeah, this is your body talking to you on the outside. It's giving you a reflection of what is on the inside. So, I mean, there's a lot of things that happen with diabetes, you know, and I'm not beyond testing everyone. I don't care. I mean, recently I went to a birthday party and there was a little girl there and she kept stuffing her face with cake and pizza and cake and pizza, and she kept coming back 2 and 3 times, you know, cake and pizza. And I went up to her and I said, you know, I said, honey, I said, what are your blood sugar numbers? She goes, I don't know what that is. So I went up to her mother and I said, have you ever had your daughter checked for diabetes? Do you know what her numbers are? And her mom said, no, I don't. Why? Do you think there might be an issue? And I'm like, yeah, I think there might be an issue. So I said, if you don't mind, can I test her blood sugar in about an hour when that sugar starts to settle? Do you mind if I test? And she said, no, I don't mind if you test at all. So an hour went by and this little girl's 12 years old. I checked her blood sugar. Her blood sugar was 167. I was like, okay, you know, she's like, oh, I need to get her to a doctor. I said, you don't need to get her to a doctor. You need to change her diet. You know, she can't keep eating pizza and sugar and soda, you know, pizza, cake, and soda, and expect her blood sugar to stay down. It's only going to be a matter of time. Your pancreas, just like any other organ in your body, I've said it before, it's like a horse. You can only beat it so much and expect it to perform so much before it just finally just falls dead. It can't be done. So if you are diabetic, please start taking steps today to start healing your body. Do not let this, I don't even want to call it a disease, do not let this go on unattended any longer than it has to. Your sight depends on it. Your legs depend on it. Your toes depend on it. Your brain depends on it. Your heart depends on it. It's very, very, very important. Go out, get yourself a glucose meter. Everyone, at least, there should be at least one in the family that everyone can use in the family. Every household should have a glucose meter or glucometer, whatever you want to call it. Just go get yourself one. For the whole setup, you're talking $35. $35 is a very small price to pay, you know, compared to losing your eyesight. So until next time, and God only knows what I'm going to be talking about, but I can assure you that it's going to be good for you and it's going to help out your health. And I'm actually going to be doing more videos. Please like, please subscribe. I'm going to be doing more videos on how to test at home. I'm even going to show you how to take care of your thyroid, how to test your thyroid, so that you can find out if you're having thyroid issues. And so there'll be more tests that you can do at home. You don't even have to go see your doctor. All right, so till next time, you know the drill. Stay healthy, stay happy, check your blood sugar. See you later. Bye-bye.